Well, CBN medical reporter Lorie Johnson is here to help us navigate the days ahead. Lorie, is our medical system, healthcare, ready to have a surge in potential cases?
Well, Pat, it depends on how large the surge is. We are definitely prepared for a moderate surge, maybe even a large surge, but not a catastrophic surge. And so that's why all these implementations are being enacted right now to try to keep people from getting sick and from spreading it to other people, because we know that there are a limited amount of, for example, supplies for hospitals, hospital beds, and then, of course, hospital personnel. And all sorts of emergency things are being put into place to expand that. And it's really quite impressive. But there is a limit. And so what the strategy on behalf of the White House Coronavirus Task Force is to flatten the curve so that it doesn't peak up like a mountain, but rather it increases more like a little hill. And we can all do our part to aid in this effort. And number one, stay home. That's the best way to avoid getting sick and making other people, is to just stay home. And then also, of course, all those other things that we've been talking about for weeks, washing your hands and disinfecting surfaces.
Oh, Lorie, we've been talking about that gut and so forth, and I heard somebody talking about zinc. Are there any things that will build our immune system so that if this virus does come, it will not be as devastating?
So many things, Pat, and it's a great point, because really the reason people who are older are at higher risk is because as we age, our immune system becomes less robust. And what that means is if the virus does enter our body, and we hope that it doesn't, we're trying not to let that happen, but if it does enter our body, then the immune system kicks into gear and tries to kill it. And so there are all different types of things we can do to strengthen our immune system. Number one, sleep. Sleep is so important. Also, Pat, stress is one of the worst things we can do, because we know that stress actually hampers our immune system. And what is stress? It's anxiety, it's fear, especially chronic stress, stress that goes on for days or weeks or months at a time. So we really need to stop worrying, because that actually makes it harder for us to fight off disease. And then also sugar. We know that diet is a huge part, and sugar increases inflammation. We know that it is not good for our gut bacteria. And we know, we've been talking about this for years, that our gut is where 80% of our immune system resides. So all those wonderful bacteria, we need to get those in there and stay as healthy as possible.
All right, now, what should people be looking for? What are the symptoms of this COVID-19?
Well, there are three main symptoms. This is a respiratory disease. And so we're looking for cough, for difficulty breathing, hard to catch your breath, in some cases, high fever. And although I will say, though, for people who are age 65 and older, a high fever is 98.6, because as we know that the reason our fever sometimes spikes is because of our immune system. And people who don't have a stronger immune system, a high fever is 98.6.
All right. Well, at what point should they go to the hospital? People are being advised to stay home. When should they go see a medical professional?
Really never, unless you're invited, because we need to call our doctors first before we go into, we don't want to, if we think we might have this disease, we don't want to walk into the doctor's office and infect everybody in the waiting room. And then, of course, as I spoke before, we have to be extra cautious to not get our healthcare workers sick. So if you think you have it, you need to call the emergency room ahead of time, call your doctor. But if you do require a test, your doctor will help you to get that in order if you present certain symptoms that do require you to get a test. But do make that call ahead of time. Just don't walk into the emergency room if you think that you might be sick.
The stores have sold out of toilet paper. How about the stuff that we need to get the gut, the probiotics? Have they sold out of that too?
Well, I can tell you no, because I was at the grocery store this weekend and I noticed that all the things that I normally buy were still there, like the organic things and the kimchi. There's plenty of kimchi, I can tell you that right now. And so, and as President Trump said, He has been in talks with grocery stores in that industry to assure the American people that the supplies will still be coming. We've seen all kinds of things like bars and restaurants shut down, but the grocery stores will remain open and they will continue to be stocked.